Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, anti-aging drug Regrows knee cartilage in major breakthrough that could end knee replacements, an injection that blocks the activity of a protein called 15-PGDH, which is involved in aging, can reverse age-related cartilage loss in the knee joints of old mice. The treatment also prevented the development of arthritis after knee injuries, such as ACL tears, which often lead to osteoarthritis. Samples of human cartilage from knee replacement surgeries also responded to the treatment by generating new, functional cartilage, suggesting that joint replacement surgery may become unnecessary in the future. The protein 15-PGDH is a gerozyme that increases with age and drives the loss of tissue function. Blocking its activity results in an increase in muscle mass and endurance in old animals. The treatment works by causing chondrocytes, the cells that produce cartilage, to change their gene expression patterns and regenerate hyaline cartilage without the involvement of stem cells. This is a new way of regenerating adult tissue and has significant clinical potential for treating arthritis due to aging or injury, as there is currently no drug that directly treats the cause of cartilage loss. The researchers are excited about the potential of this treatment and hope to launch clinical trials to test its effect on cartilage regeneration, as a similar trial has already shown it to be safe and active in healthy volunteers. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. /speak